How effective is vagus nerve stimulation for sleep apnea? Have you ever wondered how effective vagus nerve stimulation is for sleep apnea? This technique involves sending electrical signals to the vagus nerve, which helps control various body functions, including breathing. While it sounds promising, the reality is a bit more complicated. Research has shown mixed results regarding the effectiveness of vagus nerve stimulation for treating sleep apnea. In fact, some studies indicate that it may actually worsen obstructive sleep apnea in certain patients. For example, there was a case study where a patient with epilepsy experienced an increase in obstructive apnea events coinciding with the activation of the vagus nerve stimulation device. Polysomnography, which is a type of sleep study, revealed that many obstructive events began right after the device was activated. This suggests that vagus nerve stimulation could potentially trigger or worsen breathing issues during sleep. Further analysis has found that obstructive sleep apnea is a common side effect for over 25% of patients who receive vagus nerve stimulation therapy. This has led experts to recommend routine screening for sleep apnea in patients undergoing this treatment. On the flip side, some experimental studies involving low-level vagus nerve stimulation in animal models have shown potential benefits. These studies suggest that low-level stimulation might help reduce complications related to obstructive sleep apnea, such as atrial fibrillation. This is achieved by balancing the autonomic nervous system and improving heart function during apnea episodes. However, these findings do not directly support using vagus nerve stimulation as a primary treatment for sleep apnea. Currently, vagus nerve stimulation is not considered an effective or standard treatment for obstructive sleep apnea. Other nerve stimulation therapies, like hypoglossal nerve stimulation, have shown more promise. Hypoglossal nerve stimulation targets the muscles that keep the airway open, helping to reduce apnea events. However, it is important to note that the effectiveness of this treatment can decrease with higher body mass index. In summary, vagus nerve stimulation often worsens obstructive sleep apnea events rather than improving them. While low-level stimulation may offer some cardiovascular benefits related to sleep apnea, it is not a reliable treatment for the condition itself. Patients receiving vagus nerve stimulation for other health issues should be monitored for any signs of developing or worsening sleep apnea. Alternative therapies are generally preferred for managing obstructive sleep apnea.